Dehydration during pregnancy. Well, as a man, that's not something I have to deal with. Or is it? Because, we men have our counterparts who are dealing with pregnancy, and then if they are dealing with dehydration during pregnancy, what do we do? Doctor, what are your thoughts about dehydration during pregnancy?
Well, everything I pretty much have to say, because in medical school, we only spent, or about maybe 3 months in OB-GYN. And so everything that I'm going to be speaking about is from my own experiences with my 4 pregnancies, and also from what my OB had told me. But hydration is very, very important throughout your pregnancy. In the first trimester, when you're going through all the nausea and the vomiting, the morning sickness, they call it, keeping hydrated will help with that. So you don't have as much of those hormones, circulating around your bloodstream that will cause you to be nauseous. As you get further along into your second and third trimesters, you might start feeling more cramps and more contractions, and that usually is because you're dehydrated. When I had my very first pregnancy, I did have the issues with, swelling around, the lower parts of my legs, my ankles and stuff, and the pain that was associated with that. And even though I had this big jug of water that I carried around with me, my doctor did say, "You're drinking some, drink more," because it sounds counterintuitive, but the less water that you drink, the more pulling you're going to have of the lower extremities. The more water you drink, the more your body's going to be able to pull that fluid up from your lower extremities up back towards your heart to be circulated.
So I'm going to ask a question that I absolutely have no answer, no understanding of. But when a woman's water breaks, is that causing some kind of a dehydration during pregnancy potential issue? I don't know, doctor.
Well, I don't know, so I might be wrong, but just from my knowledge of medicine, is that during your pregnancy, that water is accumulating in there to keep the baby inside the womb nice and and supple and well hydrated in there. And so losing that is not necessarily so much because you're supposed to be building that through your pregnancy. And then that's just part of the birthing process. So I don't think it necessarily creates a dehydration state because it's already accounted for.
Okay. So that water doesn't according to what we may understand or know, that water doesn't directly deal with hydration, which is fine. I didn't know. Now, as we're dealing with dehydration within the massage therapy area, Irene, you have certification in prenatal massage. First of all, what is prenatal massage?
That's giving a lady who's pregnant a massage.
So how is that different from from a regular massage?
Well, there are certain areas you don't massage as far as any kind of pressure or anything like that, because you can trigger pregnancy off, delivery. I'm still not saying the right word.
Delivery. Right.
It put her into labor.
Right.
So there's that. So you want to avoid those places, as well as you have thrombosis that can be taking place. So you don't want to be messing with those veins. So there's different things you have to be aware of for prenatal massage.
All right. And now that we're aware of those things, as a massage therapist who does prenatal massage, dehydration during pregnancy, is this something that you address at some level within your massage therapy practice.
Yeah, because a lot of them come in because of the swelling in the legs. Well, that's due from dehydration. And so encouraging the lymphatic system to pull some of that up and out to give them some relief from the pressure on their legs is one of the things that they come in for. The other is, of course, the lower back. So being able to massage and stretch those muscles out and encourage more water intake.
So I know there's another massage modality called lymphatic massage. Is there a difference between prenatal massage and lymphatic massage, or are they basically using the same ideas or same concepts from a different name?
Oh, they're vastly different, because a prenatal massage, other than missing those spots that need either extra light care or that a lot of the movements in that are similar to just a regular massage. It's just additional knowledge that is needed. Whereas a lymphatic massage is very superficial, and you're just moving the skin slightly to encourage that lymphatic system to kick in gear.
So dehydration during pregnancy. Are there any other thoughts that anyone would like to bring forward as it relates to dehydration during pregnancy? All right, well, that's our information on dehydration during pregnancy. Next up, we'll be talking about dehydration dizziness. But as it relates to this topic of dehydration during pregnancy, we hope you have enjoyed our information.